Morning, folks. Ron Ray here, and for today's video from Turning 65 Solutions, we're going to talk about nursing home care. Does Medicare pay for nursing home care? Now, there's a very important distinction that we need to make here before we answer this question. There's two different types of care that you can receive in a nursing home, what's called a nursing home. Now, remember, when we're talking about long-term care, there's different levels. There's home health care. There's care that you can have in your home where somebody's just coming into your home and helping you with the normal activities of daily living. There's typically 6 activities of daily living that we talk about: bathing, dressing, eating, toileting, doing housekeeping, these kinds of things. That's one level. The next level would be an assisted living facility or assisted living community, where you need help with just those things, those same things, those activities of daily living, but you're going to go live in a community or in a facility where they do that for you. And then there's nursing home care, and that is still considered long-term care, not medically necessary long-term care, but it's called custodial care, where you're in their custody, in their facility, and they're taking care of your activities of daily living. But that's the only care you need. You don't need extra medical care like physical therapy, speech therapy, wound care, things like this. That is what we'll talk about in a minute. That's called skilled nursing care, and that's what Medicare covers. So if we're talking about strictly nursing home coverage, activities of daily living in a custodial setting, then the answer is no. Medicare does not cover that. And so what are your options? Your options are to have a long-term care insurance policy. We've covered that in other videos a couple of times, so I'll put a link to some of those videos down below. Or you can have a Medicare Advantage plan that may cover a little bit of that, but again, it's just going to be a little bit. It's not going to be much. It's going to be a few days. Okay, so that's really the gist of it when it comes to nursing home coverage. So this is an article on our website. I'll also put a link down below. But just so you can see, I want to take you to the Medicare website, and where it's talking about nursing home care. And I'm just going to read this first paragraph to you. It says, Medicare does not cover custodial care if that's the only care you need. Most nursing home care is custodial care. Custodial care helps you with the activities of daily living, like bathing, dressing, using the bathroom, and eating, or other personal needs that could be done safely and reasonably without professional skills or training. Medicare Part A may cover care in a certified skilled nursing facility, but it must be medically necessary for you to have skilled nursing care, like changing sterile dressings. Okay, so now, let's say that you do need that skilled nursing facility care. Let's see what Medicare says about that. Medicare does cover skilled nursing care, or at least a portion of it. And it's covered under Medicare Part A. So remember, that's when you're admitted to a facility. We always talk about a hospital, but it could also include a skilled nursing facility. Medicare Part A hospital insurance covers skilled nursing care in certain conditions for a limited time, really short-term basis. This is not long-term care. If all these conditions are met. Number 1, you have Part A and you have days left in your benefit period to use. Number 2, you have a qualified hospital stay. You have to have been in the hospital for 3 days before you go into skilled nursing facility care. Okay, that's the only way you can qualify for Medicare to pay for a skilled nursing facility. Your doctor has decided that you need daily skilled care and must be given by or under the supervision of a skilled nursing or therapy staff. You get these skilled services in a skilled nursing facility that's certified by Medicare, and you need these skilled services for a medical condition that's either a hospital-related medical condition treated during a qualifying 3-day inpatient hospital stay, even if it wasn't the reason you were admitted to the hospital, or a condition that started while you were getting care in the skilled nursing facility for a hospital-related medical condition. For example, you develop an infection that requires IV antibiotics while you were getting skilled nursing care. Okay, so there's a lot of conditions, and the doctor has to certify that you meet these conditions, and they have to certify on an ongoing basis that you meet these conditions. It's not just one and done with the doctor. Now, Medicare doesn't pay for all of it. They pay for the first 20 days at 100%. So you'll be out of pocket for zero for the first 20 days. But for days 21 to 100, you're going to now have a $185.50 co-insurance or copay per day for days 21 to 100. So Medicare's paying all of the bill after you have paid $185.50 a day. Now at day 101, Medicare's out. They're not paying anything else. At that point, they now consider that to be a long-term care situation. And of course, we know that Medicare does not cover long-term care. So that's it. If you had a Medicare supplement that covers this, like a Plan G or a Plan N, then they would cover that $185 for you for days 21 to 100. So you'd be out of pocket basically from day 1 to day 100. You'd be out of pocket $0. But days 101 and beyond, you're on your own. Your supplement isn't even going to cover that. Medicare Advantage plans will also cover a portion of medically necessary skilled nursing facility care, but each one is different. They cover just a little bit differently, and your out-of-pocket cost is going to be different. So we really need to evaluate the plan based on the location that you're in and the needs that you might have. So, folks, this can be a complicated issue. We get these questions all the time. So we're very well versed in how to answer the questions and deal with the situation. So if you have any questions at all about this, please give us a call. The number is 830-217-6711. Also, look us up on the web at t65s.com. We've got a great little article right here on our webpage about skilled nursing care, nursing home care. I'll put a link in the description down below. And also, if you found the information in this video helpful, please give us a thumbs up on the video down below. That helps YouTube get this video out to other people who are searching for the same information that you are. And be sure to subscribe to the channel so that you can be notified when we upload a new helpful video. So I do hope you enjoyed it. Again, if you have any questions at all, give us a call. And until the next video, we hope you have a great day. Thanks, folks. Bye.